And you can see recording. Hello. I think we're recording now. So we're going to go ahead and get started, and we're hoping that more participants will be joining us. We're expecting about 8, but I know that there's a lot going on this time of year. So my name's Colleen Peterson, and this is my very first webinar, so I'm really excited and a little bit nervous, but I'm actually more excited than nervous about doing this. So we're using Adobe Connect for our platform today, and there are some cool tools here that we can use. If you look up in the top dark bar across the top of your screen, you'll see the silhouette of a little white silhouette with the arm up, and there's some if you click on the drop down menu, you can actually give me a little feedback that way. I will not be able to hear you, so that's one way to try to get my attention. The other way is to put a comment down in the chat box, and the chat box is down in the lower right hand corner, and we will be expecting hopefully some interaction, especially if we get more participants. So Lacey's giving me some applause, so that's awesome. I feel very encouraged. So I can't see you or hear you, but that's the best way that we can interact. So I'm going to go ahead and introduce myself a little bit more. So I am a registered nurse, which was kind of my first career, and then I transitioned into education. So they seem like kind of different careers, but there are actually a lot of areas where it overlaps. So currently I am very, very blessed and lucky to work for the Napa County Office of Education. Program manager is my job title here in our College and Career Readiness Department. I also work very part-time as an administrative nurse on call for Butte Home Health and Hospice, something I can do on the weekends. Hi, Jesse. I hope you can hear me, and glad you could join us. So as a registered nurse, I have a bachelor's degree, and pediatrics was my specialty area. So that's kind of how I feel like it overlaps with education, because I worked with children and teenagers, and I did work in the home environment after I kind of got started in the hospital. Currently in education, which is my main career, I am, like I said, a program manager, but I was a CTE teacher, so I taught medical and hospital careers, and what I'm basing my webinar on today, and then moved into a coordinator through the ROP, and you can see a little bit more about me. Okay. I feel like I need a disclaimer because even though I have expertise in what I did and what worked for me, I feel that there is no one size fits all, and what I did may not be fitting for your situation. So I will note that if you're going to do internships with students, that you need a good block of time. I taught a 2-hour block, and so that's I think pretty important. But this is the model that I used, or the situation that I had that I'm basing the webinar on today, is my experience. So I taught for 13 years in Northern California. The class was a health occupations course. I taught at 3 different comprehensive high schools. Like I said, I had a 2-hour block, and we didn't do block schedules. Every day was pretty much an hour per period, and I had 2 periods. So we did have some shorter days, but we didn't have what we call block schedules. But I know a lot of schools do that, and so I think you can work around that. I had mostly 12th graders, a few juniors, but mostly 12th graders in my class. And our time in class was spent about half of our time in the classroom and about the other half of our time outside of the classroom, mostly in internships. When my students were in internships, they got to do multiple rotations. I started out doing 3 rotations the first couple years, and then realized that was a bit much, and so ended up going to 2 rotations, which I believe were about 7 weeks each. I have worked with 3 different hospitals doing this. One was an independent nonprofit, one was a private nonprofit, and one was part of the Adventist Health system. And then, of course, a lot of other sites besides hospitals. So one disclaimer that I put an exclamation point on is that every hospital has its own policies and procedures, so it's very important that you follow them. And of course, your district and your school will have policies and procedures, and you need to follow those as well. Okay, so I'd like to find out a little bit about my audience, which is very small right now, but we'll go ahead and do this. So I'd like to know a little bit about what your role is. So I'm going to put this little survey here, and you can go ahead and click on the response. Oh, let me open it. Poll. What is your role? Let me look at this. Poll, what is your role? Reopen. Here we go. Is it open now? Yep. Yay. Okay, while you guys are doing that, I will put the other poll up. Reopen. Okay, I'll give you a little bit of time. And looks like we've got 2 respondents. Yay, oh, more. Okay, so it looks like I'm talking to CTE administrators, and the type of work-based learning that you're already doing is guest speakers and worksite tours, and looks like maybe some internships. So again, I want it to be as interactive as possible, so keep putting those notes down there in the chat box, and I'll try to look down there periodically. Okay. Oh, I got to get rid of the polls. Hang on. How do I exit them? I think I go here, hide, here, hide. Okay, moving on to goals. So I came up with some goals for our time together today, and so you can see them. I want to support you in embedding high quality CTE in your health pathways. We're going to talk a lot about risk, so how to manage it, and because there is a lot of risk in healthcare. And also we want to maximize benefits, and the two go hand in hand. And I also want to give you some really practical advice and tools that work for me, and some encouragement. But I'd also like to know what your goals are. So if you wouldn't mind maybe typing in some goals into the chat box, I'll give you a little time to do that. Doing work-based learning, but not in all pathways. Okay. Always in need of more internships in healthcare. I hope that I can help with that. Oh, we got Deb here too. Yay. Thanks for joining, Deb. We're just putting down some goals in the chat box. If you can see that down in the lower right-hand corner. That's okay. And I think Jesse has one more. Any more goals? More job shadowing, more opportunities for internships. so students can learn from professionals without having to leave the school. Well, that's going to be hard because we do have to have them leave the school. But yeah, it is a challenge in rural schools. Oh, and for informational interviews. Okay. Well, and you guys can just keep adding those. We're going to go ahead and march on forward here. I wanted to talk a little bit about the healthcare industry. And of course, this depends on where you live, what it looks like. But a lot of people may or may not be aware that it is actually the largest industry in our country and also the fastest growing industry, especially with our baby boomers aging. It's anywhere between 10 to 15% of our gross national or domestic product. And it's estimated that 4 million new jobs will be created, by 2016. That's an old statistic, but it is growing. It's a very complex and changing industry, and of course it has many, many occupations. So I've been told about 200 different occupations fall under this healthcare umbrella, which I think is wonderful because when we look at our high school student population, we can take all students in the health pathway. It doesn't have to be only the pre-med or the pre-nursing students. We need entry-level healthcare workers, and then there's a lot of occupations that are you can do after just a couple years of education beyond high school. So it's a really great fit for CTE programs in high schools. Typically, there are a lot of students who are interested in healthcare. And the other reason why there's a lot of high interest, at least in what I found, is that students who want to get into nursing programs or other post-secondary healthcare programs, it's very difficult to get into. It's very competitive. And so taking a program like this in high school really gives them an advantage. Not only does it give them the knowledge, but sometimes it creates points for them. I know at Chico State, their nursing program was highly impacted, but by taking my class in high school, it got them some points toward that acceptance. A little bit about work-based learning, which we abbreviate WBL. And as you can see, it's a continuum. So I define work-based learning as students having direct interactions with real people in a real occupation. So I like face-to-face work-based learning, but it doesn't necessarily have to be, but there has to be some kind of interaction. So it's progressive. We usually start with awareness of a career, a little bit of exploration of different careers. There are a lot of careers in healthcare that high school students have no idea they exist. They typically think that, the pediatrician and a nurse and an ER doctor, things they see on TV, those are the occupations they're familiar with. But there's all kinds of really hidden occupations and some really cool ones. Okay, and then it progresses to preparation, and so that's what we're getting into with our high school CTE programs. And I feel like there's a lot of preparation that we do just to get them into an internship, and then of course the internship prepares them to go on. And then as far as actual training, typically this can happen after high school with getting a certification or a license. I know some high school programs do give student certifications, but that wasn't my goal when I was teaching high school. And you could split this in multiple levels, multiple years. You could focus on the awareness and exploration maybe in year one, and then more of the higher level in year two, etc. So. Okay, this hopefully the 11 elements sounds familiar. It's what we kind of our marching orders with CTE. And I just wanted to mention it because we are going to be addressing some of those elements today. So element 2 was about high quality curriculum and instruction. Element 5, industry partnerships. 10 and 11, all of these will be touched on by having high quality work-based learning in a health pathway. So, all right, and thanks for joining us, Les. We got you here. Hopefully you can hear and see me. So if you have any questions, just add them down to the chat box down at the bottom right-hand corner. So we're going to focus on a couple areas before I get into really practical tools, and those fall into 2 categories. We want to talk about risk, how to minimize it, and also how to maximize the benefits. So first, let's talk about what are the potential risks to students. Like what could go wrong putting students in internships in the hospital, right? Well, obviously, we don't want to put our students at risk as far as getting sick, and students can become exposed to different things in hospitals, contagious illnesses. Um, there's also injuries, and these happen actually fairly often with me. I had a lot of students faint. It was usually at the very beginning of the school year or their first exposure to something. They would faint, maybe seeing a needle, watching a blood draw. I had a student faint watching a circumcision. And then sometimes when they faint, they fall. And so that can be quite serious in the operating room if they're observing or something like that. They can faint and hit the floor and hit their head. They could also injure their backs, maybe moving a patient or carrying something or, not using proper lifting techniques. There's a pretty off chance that they would have a needle stick because they probably wouldn't be handling needles, but they could have some sort of exposure to blood or some kind of needle injury. So another area that I put on here is harassment. And, it's a big topic right now in our media, but I actually had several students who were the victims of sexual harassment while they were students in my class. Sometimes by coworkers in the hospital, sometimes patients can say inappropriate things, or visitors, family members, and that kind of thing. So that's another risk. And then there's a whole lot of emotional stress that can be put on students when they're in these kind of internships, because hospitals are very raw. There's death, there's trauma, there's grief, there's, obviously illness. And so it can be a very harsh environment. And so these are all things that we want to keep in mind as we prepare our students. Other risks that are not necessarily to the student but can be a huge risk would be a breach of confidentiality, which would be a HIPAA violation. And this has happened as well in my experience where students have said something that they shouldn't have said, and we had to file a report, and there's potential fines. In this case, we got off without a fine, but we had to be very open and honest about it and report the breach. There's also a small risk of liability if a student were to do something that outside of their scope. They really should be mostly observing or be under direct supervision, but a student could cause harm to a patient. So obviously any action or event that puts your students at risk or puts patients at risk or put the facility at risk for some kind of legal action or liability will put your program at risk. So we have to avoid all of those things. And so the way that we do that is to have really close working relationships with our business partners. Rewards, of course, there's lots of great rewards. So after doing this for many years, I had really positive feedback from my students. Many of them went into health occupations, and I would run into them later, and they usually had very wonderful things to say about the experience, how it helped them when they got into college courses, how it helped them when they got into different post-secondary training programs, and I do run into them out in the healthcare occupation. So they get a realistic view of the workplace, which I think is really important. I find that TV does not portray healthcare very accurately. It's more entertaining on TV, but it's not very realistic. So internships are really good for that. It helps students visualize themselves and helps them really see what it's like. And it builds confidence in them that this is something that they can do. So I also find that people in healthcare want to contribute to the youth, and they get a benefit out of it when they have a positive experience with an internship. And of course, it will build a pipeline for future employees. So hospitals, the hospitals that I worked with were really favorable about doing this, even though, there was a lot to it. It helped them build their pipeline and really be part of their community. So. Okay, so we have to balance two priorities. And in order to do this, we really have to have our students well prepared, and we have to have really good relationships with our sites. So I think we're going to start with the first one, is preparing the students. This is a lot of work. So it starts with student selection. Les, I'll get back to your question at the end. I personally have not used NEPRIS, but our agency does use it. So I'll get back to that at the end. I do see your question. So Okay, so selecting students, you need to make sure that you choose students well, and you need to prepare those students. So when I say to choose students well, I don't mean just choose the A students. I really looked for students who had good attendance, students who had good attitudes. My class was impacted in that more students wanted to take it than I had spots, and that put me in a good place to make the students really show that they had the initiative and the right attitude to get into the class. So I maybe would hold an orientation meeting in the spring before they got in the fall, or they would have to go through an interview process. You can do a lot of different things. When you have students in your class who don't want to be in your class, it's a lot more work. It's not impossible to get those students turned around and motivated, but it really helps if you have a class full of students who really, really want to be there. The other thing that you have to do is set really clear expectations and really high expectations for professionalism, and spend a lot of time on that before you put them out into those internships. And of course, HIPAA training, we start with that on day one, and we really go over that over and over, and you'll hear more about that. I had an attendance policy with my students where they had to give me prior notification for any absence, in-class absences. So this is different than typically what high school students are used to. They're used to missing school and having their parents call and excuse their absence, and it was excused. But the workplace has a different expectation, especially in a hospital. You had to call in 2 hours before your shift started because they had to cover your shift either with calling in somebody in or somebody else staying and working overtime. So that was an expectations for in class. And so that by the time they were ready to go out in their internships, they had that habit established. And so my students had to give prior notification. I didn't expect 2 hours prior notification. I just said before class started. And we used email for that primarily because it was easy for them to send me an email and then the time was on it. It's a little more difficult to be getting phone calls. So my students were told that they had to demonstrate that they were ready for the internship, otherwise they wouldn't be placed in the internship. And I started internships right before the semester break, so if they just weren't going to be able to do what they needed to do, then they could be dropped at the semester. And the students have to be pushed out of their comfort zones. So even though you may have a classroom of 8 students, it doesn't mean they're ready for being placed out into an internship. So, and I'll explain what that means. So this is how I prepared the students in the fall. So I had what we call out of class activities pretty much once a week. I tried to do them on Thursdays, so that was kind of easier for the students to remember. And we started outings on the first week. We would go to another site to try on our scrubs and have their picture taken for their name tag. Now, I could have done that at the school, but what I was trying to do was simulate how are these kids going to figure out how to get where they need to go, and are they going to remember that they need to go there, and are they going to follow through, and those kinds of things. And that was a real low risk field trip. Just go. And the bathrooms aren't nice at school anyway, so we would go. We went to the ROP office and they tried on their scrubs there. Then the next outing we did was a hospital tour. And of course, they had to dress professionally for that. So there's kind of two things we're looking at. Did they show up at the hospital tour? Did they dress appropriately? Maybe they were wearing their scrubs, or maybe I did business attire. It kind of depends on if everyone had their scrubs or not. We also did a tour at the community college, which was a distance that they had to get there and park and find the right building and that kind of thing. So you can see each week kind of making the field trips a little more difficult, getting them out of their comfort zones and getting them ready to be able to do this. I did an assignment where they were assigned to an assisted living facility, and they had a geriatric person there, an older person that they were matched with one-on-one, and they went 2 weeks in a row on Thursdays, spent some time with them, and ended up writing an assignment. And that put them out of their comfort zone because they had to sit down and talk to somebody, and it wasn't something that they did as a class. They did it individually, one-on-one. Professionalism surveys, another activity, and then my students did job shadows. So, and I'll go over this before I place someone in an internship. I want them to have just a job shadow, which in our case was one class period, which was a 2-hour block. So you'll get to see what I did a little later on here. You also have to build a lot of knowledge and skills into students to get them ready. Obviously, they need to know about things like infection control, and they have to have that professionalism. I use the textbook here, Diversified Health Occupations. My first unit was on the history and trends of healthcare, which is not, that important. But I also found that the first couple weeks of high school, there's a little bit of shifting around, students adding, students dropping. So you don't want to cover something really important the first week of school and then have somebody add your class the next week. So we kind of did that just to get started. We talked about the different types of facilities, all the different types of education, licensure. We talked about health insurance. There's just a lot of systems around healthcare, around the industry. And then we got into all the different careers related to healthcare. And this is where I started work-based learning by bringing in the guest speakers. So this is the exploration phase. I got guest speakers. I had a lot of friends in healthcare. Well, the first couple years they would come, but then they don't want to come every year. So I started getting the students to give me names if they had parents, neighbors, people that they knew. So every year the guest speakers were different. Like I said, we did a tour of the hospital. And students also had to research a health career. And when we went to the community college, that's the thing that they did. We went to the Career Center and they used some of their tools there to research health occupation. We spent a lot of time on personal and professional qualities. So in other words, being honest, taking responsibility, being dependable. It seems kind of obvious, but those things are really important. We made posters, we put them up on the wall. We would refer to them when we felt like maybe someone didn't have that quality. And we also talked a lot about appearance. Not that everyone has to look the same, but there are things that you can do to make yourself look more professional. So legal and ethical responsibilities are really important. And here HIPAA comes up again. So talked about it. Really, you can role play, really talk about different scenarios. You have to make sure that they can maintain confidentiality. We did a whole unit on geriatric care, and that coincided with the geriatric visits. Sometimes people don't realize that a high percentage of patients are elderly, that the hospital's not full of kids and teenagers, it's actually full of old people. So they have to know what that's like to work with. And some students have a lot of experience with their grandparents or with older people, and some students don't. So we also did a job seeking skills unit on resumes, interviewing, and so forth. Safety and infection control, you have to have a good knowledge of that before you can put them into any kind of healthcare environment. We also taught them how to take vital signs, and kind of interwoven throughout this, we did abbreviations and medical terminology. So all of this was done in the fall. And what's next? Some of the assignments, I've alluded to these while they were doing those units. They researched a career, they wrote a resume, and then we had to put them through hospital orientation. And so this is where you would be working with your hospital. And if you have more than one hospital, then I guess you'd work with both of them. And what I did is I usually worked with someone in their HR department, someone that was designated to be the sort of the educational liaison, get to know that person really well, build a really good relationship with them. And these are the kinds of things that the students had to accomplish and check off before they were allowed to do any kind of an internship. And this takes months to get this done, or at least weeks, maybe not months. TB screening, so that's a two-step process where they get a TB screen, and then they had another one, I believe, 2 weeks later. We had to have proof of all their immunizations, and I worked with the school nurse to get those records, but they also had to get a flu vaccine for flu season. Then hospitals will have forms. They'll have in-service modules. Sometimes they would come out and speak to the students. Sometimes the students logged into something. So it really just depends on what your hospital does. You have to do everything that they require. You can't tell them what you're going to do and what you're not going to do. They call the shots as far as what people have to do to be in their hospital. I mentioned that students did job shadows. It's mandatory that they write a reflection on each job shadow, and that came in really handy. later on when I was placing them in their internships. And I also had my students do CPR certification. It's not required, but it's a nice thing for them to know. They like doing it, and I think it's kind of impressive when they're certified. Okay, well, I've been talking fast and it's already 4 o'clock, but I want to pause right here to see if you have any more questions. So if I've raised a question so far, go ahead and enter it in the chat box. Otherwise, I'm going to plow forward because we have a lot more slides to cover. Okay, then let's go on. The second priority that I mentioned was site relationships. And this is also really important because if you don't have good job sites, the students will be bored, or if the students don't know what to do in their job site, or if they're not appropriately supervised, you can run into trouble, and that's where we get into those risks. So let's talk a little bit about that. So how do you find job sites? I found this was kind of challenging when I first started, but I built on it every year. So what I did, and again, this is just what I did, doesn't mean you have to do it. I wrote a letter, kind of a business letter, explaining my program, explaining a little bit of the preparation that the students were going through, how to get a hold of me, and I basically went around and passed out this letter face to face to all kinds of people, all different departments in the hospital, all kinds of different clinics, doctors' offices, etc. I also had the students give me a list of what they were interested in. So in other words, if someone was interested in chiropractic and I didn't have a chiropractor, then I would drop this letter off at 4 or 5 different chiropractic offices. So, so the students would also give me contacts. They know people, they have neighbors, they have parents, they, have friends that are in healthcare, especially in a small town. I did this most of the time in Chico, but I was actually in a couple other towns that were similar size. If you are in a big city, then it's going to look different. So again, you have to work with the hospital, and so contacting that person in the HR department or whoever it is, maybe it's in the nursing education department, and then get their permission to contact department managers, because you do need to build relationships with all these department managers, but you can't go directly to them without getting permission from HR. So that's what worked for me. I had actually worked at the main hospital that I used in the, prior to going into teaching, so that helped. I already knew a lot of people. I had a lot of relationships. And then, so that kind of covers the hospital, and then there's all those other areas. And like I said, there's, kind of an endless list here, but surgery centers, doctors' offices, chiropractors, imaging places, pharmacies, clinics. I did use a school that had special needs students. I had a lot of students who were interested in pediatrics, and you can't always get enough sites for that. So a school where there were special needs kids, maybe they're getting some PT, OT there. That kind of worked for that. A rehab hospital, and what I mean by that is physical rehab. Community agencies, maybe the WIC program, which is a nutrition program. I even had a student at the homeless shelter because they had case managers there, and she was interested in working with mental health. And it's hard to get students sometimes into mental health or behavioral health programs, but by working at the homeless shelter, she was able to see counselors, and because a lot of their population does have mental illness. So don't forget about the VA. They have a great clinic, hopefully. Infusion centers. We did do some dental offices, not a lot of dental. And then also fitness centers, like sports clubs and things like that. They have trainers there. They also have childcare centers there, so that could be maybe another pediatric site. So every year I just built on my list, and it's really important to keep your list happy so that you can use those sites over again, and then every year maybe try and build a few more. So here's my little cute saying on industry engagement. Actually, I didn't write this, but I think it's great. It's a lot easier to send a drink across the bar than it is an engagement ring. So basically, you start with a small ask. ask somebody if they'll be a guest speaker, or can we come have a tour of your facility, or ask for a job shadow. Don't introduce yourself and ask for an internship site. That's too big of an ask. So start small and have positive experiences for them and for your students, and then build on that. And so, and then of course you'll want to be building your advisory committee as you gather all these internship sites. So, okay, so you got to nurture those sites once you get them. And the way you do that is by just having good relationships with them and having really good, clear communication. You don't want to over communicate, like they are very busy. You have to put yourself in their mindset. They don't like to be called on the phone. They are very busy during flu season and peak, winter type season. So think about what their schedule looks like, what their job looks like, what their shift looks like, and try to communicate in a way that's efficient for them. So email worked pretty well. Any concerns that they bring up, make sure that you are addressing them. Don't ignore their concerns. If they feel like you're not hearing them or you're not addressing them, then they'll probably say no the next time you ask them for a student. One of the problems people had is they're not sure what to do with the students. So try to clarify. And I always said, the students are there to learn about an occupation. They're there to experience healthcare in a real environment. They're not really going to do a lot, but they can assist, the staff, and they can observe the staff. So we use those words a lot: assist and observe as directed. It has to be done in a safe manner. There are some things they can do. They can get warm blankets. They can help push a gurney. They can, some places let them do vital signs and that kind of thing, but they have to be under supervision. If you're having issues with a student at a site where they're not happy, the student doesn't have a good attitude, or they're coming late, or they're absent, it's always more important to keep the site and take that student out of there. So, the student might want to stay, but if they're not cutting it, you got to move them somewhere else, because you want to be able to use that site for the next class that's coming around. And so always give priority to the site, but try to problem solve. Maybe the student just needs a little talking to. Maybe they're too shy or quiet, or maybe, they need to be given a warning about, their attendance or something like that. So use your best judgment. But I would always prioritize the site, because those sites are really precious and hard to replace once you lose one. I talked about advisory. When you have your meetings, have a convenient date and time. Make sure you provide lunch, because they're coming during their busy schedule. Don't have it in the middle of January where they're super busy. And I also recommend teachers doing externships where they're the intern, they're the student during the summer. It puts you in the shoes of a student, and it really helps build connections and relationships with sites. So I would recommend that if you have that option. So I've got another pause in here. So again, I know I've been talking fast, but if you have any questions of what I've covered so far, go ahead and type them in. I don't see anyone typing. That's okay. So now I'm going to move into some practical tips of how you match students to sites. And so in the fall, I had the students make a list of all their interests, okay? And then I would try and go out and get potential sites for those interests. And remember, we're not asking for the internship right off the bat. What I would ask for is just the job shadow. It's an easier ask, and I would always ask on behalf of the students. So I would say something like, well, I've got this student, her name's Susie. She's really interested in being an ophthalmologist, and I was wondering if you would let her job shadow so she could see what it's like to be an ophthalmologist. If you ask on behalf of the students, it's an easier way to ask, and it's kind of most people are like, yeah, that sounds fine. So I did have to prioritize if there were areas like a lot of girls want to be an OB, they want to be labor and delivery nurse. And so you have 7 students that want to do that. They're not all going to be able to do that. Then there is a little bit of competition, just like in the real world, people compete for jobs or positions, departments. And so I didn't necessarily give priority to the student with the best grades. I really looked at the other indicators for success, such as their attendance, their attitude, obviously good grades are a good thing. That means they're doing all their work and they're studying and all of that. But I tried to give every student their top choice or something very similar to their top choice. And some students just didn't know what they wanted to do, and that's fine too, because that's what the class is all about. So this is what I did. So the students told me what they were interested in, and then I ended up going around and getting all these different places um, that would respond that yes, they would take a student. And so I would create a grid. And you can do this on paper, you can do this on an Excel spreadsheet, or however you want. And so what I did is I put the dates of the job shadows across the top, and we did these once a week on Thursdays. So I just put in some October dates here. And then I would list on this left-hand column all the different sites. So this only has a few sites listed, but you need more sites than you have students, okay? So if you have 20 students, I would try to get 30 sites or at least 25 sites, because otherwise it's too tight to try and schedule this. So, so once you create that grid, and then you're going to start filling in the students. So I'll give you some examples here of how I did this. So let's say Susie indicated some areas that she wanted, and so I decided that Susie was going to job shadow in surgery on the first job shadow, and then she was going to be in Dr. Smith's office for the second job shadow, and OB for the third, etc. So she got 5 job shadows, and I gave every student 5 job shadows. It's a lot of work to line it up, but it gives students a good number of sites to experience. Even if they don't go back for an internship, at least they can say that they got to observe there. If you want to make this a little easier on yourself, you could add an extra, and it's kind of like when you're scheduling sports teams, they get a bye. So maybe you have an extra day where everyone has one day where they're not doing their job shadow, but you're spreading 5 job shadows out over 6 weeks. It gives you a little more wiggle room for scheduling. So there's a number of ways to do this. But I had everybody, for the most part, job shadowing at the same time on the same day during class. And then there's all kinds of scheduling things you have to work around, like swim meets and sports teams and sick days and things like that. So let's say Susie was absent. I might have a makeup day here, another column where I would have Susie do a makeup. But that's up to you. Notice I have internship here, but we're kind of ignoring that for now. And we'll get back to that after we do our job shadows. Okay, 15 more minutes. So once I got all the students assigned, then I had to notify the sites and the students of what the plan was. So I would just capture along the horizontal line, for example, Dr. Smith's office is going to have these 3 students, and they're going to be visiting on these days. Okay, so they need to know that these students are coming. Otherwise, students just show up and it's a lot of confusion and so forth. So you would do this for each job site, and you would create, you can kind of like cut and paste that information here. And I had kind of a template, and so this is a sample template. So I have the name of the site at the top is Dr. Smith's office, and I'd have their address, phone number, all the detail that a student would need to know of how to get there. A name of a person to contact, so when they show up and everyone looks at them like, well, what are you doing here? They can say, well, I'm supposed to meet, Judy, the office manager, or whatever, whoever this contact person is. If you had a specific position that the student was shadowing, you could put that here, or you could just say staff. Maybe they're going to shadow different people in that doctor's office. I always told what the students were going to wear so that the student knew what they were going to wear, but the site would also know. I would put in the time. This would be our class times. The morning class started at 7:45, and some places didn't open till 8, so then they just started at 8. So you have to make some adjustments there sometimes as well. And then I had a little bit of verbiage here that the students were assigned for a job shadow, and then my contact information, really, really important. And so I would make copies of these. Obviously, this information went to the site, so they knew who was coming. But then these 3 students also needed this information, okay, because they're going there. And this is the same information that they're getting. So if I had 5 students going to Dr. Smith's office, I would make 5 copies of this and give it to each of those 5 students. So, and because each student was doing 5 job shadows, they got 5 pieces of paper, and then they could kind of put them in order of where they were going. So again, you're going to communicate with the site. You're going to make copies and give to the students. I would not recommend doing any job shadows or starting any internships or anything like that on Mondays. People wake up on Monday morning and they don't remember what they are doing. So we always did them on Thursdays. And so that way you can see the student in class the day before, make sure they're really clear. You can go over some last minute instructions. Maybe talk about, depending on where they're going, like if they're going to surgery, that they're going to be going into a locker room and changing into the hospital scrubs and things like that. So while students are doing their job shadows each week, I can't be there where they're all at different places. So I'm kind of just usually in the classroom. But then I hear like so-and-so's sick or this didn't work out or whatever. And then I make some adjustments to the schedule. So, okay. So after everybody's done the job shadows, that's a lot of work lining that up. That's actually the hardest part, because then moving on to internships is the next step, but it's actually not as difficult. So students need to reflect after every job shadow. So if they did them on Thursdays, they would come to class on Friday, and the first thing you would do is write a reflection. It could be in a paper journal, it could be, in a Google format or whatever. You need to be able to look at those reflections, because that's going to give you a lot of insight on how that job shadow went. And after they're done with all their job shadows, I would have the students give me feedback about which ones they liked the best. So maybe they went to one and they hated it, but 3 they really liked, but then this one they liked the most. So they would give me that information. And I would also prepare students before they went out to their job shadows that their number one job was just to leave a good impression. They didn't really have to know anything or do anything except smile and have a good attitude, ask appropriate questions, and leave a good impression. So it's kind of like, even if you didn't like it, act like you do like it, because you want to leave a good impression. You don't have to go back there if you didn't like it. But if you left a negative impression, then that's going to, close the door for somebody else. So we had that little pep talk before they did those job shadows. And you can see this is really nerve-wracking for students. That's why we did all those out-of-class activities and field trips, preparing them, pushing them out of their comfort zones. I also would get back to the sites. How did it go? Did you like that student? Oh, they had a great time. I'm really hoping you'll take them back for an internship. So now you're kind of going that next step in the relationship. You got them to commit to a job shadow. Now you're kind of asking for the next step. I read all the reflections and I make the final decision. So now you're back to doing your matchmaking. And I base my decisions. You got to be objective as much as you can. And I try to place students where I feel like they will be the most successful. And it is a matchmaking process in that you know your students, you know their personalities, you know their strengths, and you also know their job sites. And job sites have personalities as well. And so if you have a really quiet student who might be a straight A student, but they're really, really quiet, and you put them in a job site where they're just going to get pushed into a corner and nobody will interact with them, then that's maybe not a place where they'll be successful. So it's a matchmaking process. It's kind of tricky. But anyway, I'm going to show you how I did it. So you go back to the grid. Now you've got some columns here that are called internship. And I only lined up one internship at a time. Sometimes I would get some things penciled in the second internship. So what I did is, in this case, Susie did all these job shadows. So here, 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 here. I looked at Susie's reflections. And Susie told me that her very favorite one was OB, and so I decided that Susie is going to get to go to OB for her first internship. So I assign her name here. And I did the same thing for Mary and Joe. Now, if Mary also wanted to go to OB because she had a shadow there and it was her first place, and really Susie and Mary are both great students and they both be really successful, that's where I might pencil Mary in here, and I'll tell her, Mary, you're not going to go for your first internship, but I'm going to let you go there your second internship. Because, sometimes people might be unhappy. But if I rarely put somebody in an internship who didn't shadow, because then they don't really know what they want. If they weren't there, they didn't. So they had to at least shadow in order to get the internship most of the time. Okay, so then it's a similar kind of a template where you're going to come up with a form. Here's Dr. Smith again. It's a little different this time because we're only assigning him one student. We're assigning him Joe, and now Joe is going to be coming every day, or every Monday, Tuesday, Thursday, and Friday, unless there's a school holiday, and we've got the time and all of those things. So again, all the information that the site needs to know, all the information that Joe needs to know, and then that information is disseminated out. So students are going to start their internship. So again, don't start on a Monday. They'll all be calling you. I forget where I'm going. I don't know the address, whatever. Start midweek. There's nothing wrong with starting, and I would start on Thursdays and end on Tuesdays. We'd have class day on Wednesday. My students did their internships 4 days a week, and we had class day on Wednesday, and Wednesday was like a shorter day schedule. So that way their short day was in class, and all the days that they were in internship were consistent hours. It's hard for internship sites to have students trying to understand schedules that, late start and early start and this, that. They like just that consistency. So if you can, aim for that. Every student had a folder that I got ready for them, and the folders had emergency information because they may faint or get sick or something, and they would need to know who to call. They'd call their parents, and it would have my contact information on there as well. My students filled out timesheets. I had training plans, any contracts or documents that needed to be signed, and I also put the students' resumes in their folder so they could learn a little bit about them. You want to nurture those internships. Again, they have to be positive experiences, not only for the student, but for the sites. Otherwise, you'll lose them. And so I would go around and make site visits. I always tried to be very positive and professional. I never wanted to go visit, let's say, a station in the hospital where there was a student, and I didn't want to walk away and have the staff go, well, that wasn't very nice, or, like left a negative impression. I always wanted to walk away with them having a good impression of me. Even if things weren't going well with the student, I would reassure them that I'd be talking with the student, I'd be following up, but I always thanked them, was always very professional with them. And again, prioritize the site over the student. I did documentation of all my visits. I just had a sheet of paper for each student, and I would just write things down, reminded not to chew gum, reminded to pull her hair back, or fill out your timesheets or whatever. So you can start to see trends of different reminders that you had to give students. Check in with students at their sites, check in with the students in class, address any issues, help the students improve. I had to keep attendance. We talked about the consistent schedule, and communication is super important. So we're running out of time. So I wanted to revisit some of those risks that I talked about. Obviously, you can prevent illness by students practicing good infection control, being under good supervision. Really careful. Sometimes I would say don't go into isolation rooms. Other times I'd say you can go into isolation rooms as long as you are following all the precautions on the sign and you're, under the supervision of staff. So again, fainting is probably one of the high risk things that's really hard to prevent. I would tell students, make sure you eat. They would go to surgery and they wouldn't have breakfast, and then the first time they see something, they'd pass out. So make sure you eat. Make sure you're maybe standing back, lean against the wall, move your legs around. People in surgery are used to a lot of students fainting. It happens at all different, levels of education. College students faint, but it's a problem because now they have a patient that they're doing surgery on, and they've got a student that's passed out, and obviously you don't want to faint and knock something over or really get hurt. So they get better as the year goes on. They get more used to things, and so the fainting usually happened at the beginning of those, usually during the job shadows. Harassment, students have to be instructed on what it is, how to recognize it, how to report it. You have to advocate for them. I went to HR with several complaints, talk to the parents, write up an incident report, all those things that you'd have to do. Emotional stress, you can't necessarily shelter them from that, but you can talk to them about it, have them come to you. I would not expect a student to have to see a dead patient or anything like that. So they need to know that it's okay. They can step out of a room if something is stressful for them. A zero tolerance policy on HIPAA, it's too important. And so if a student violates HIPAA, they're immediately dropped from the class. And you don't want that to happen because you may lose your program over something like that. And make sure that students are under supervision and they understand their role. So if there are any issues, obviously your documentation and having good relationships with your business partners. Oh, well, we are to the end and we have 3 minutes. So what I'd like you to do is just reflect a little bit. There's kind of two things. Reflect and think about how you might utilize some of this, if you can. And then the other slide is just if you have any questions. So if you would, write those reflections and those questions in the chat box, and I'll try to address them. And so getting back to Les's question, I did not ever use Nepris. I know what it is. It's a virtual platform. I always found that face-to-face was a lot better. So I did that. I had real people with real interactions with students. But I know Nepris is a valuable thing if you're in an area where you have a very specific type of guest speaker that you want, and there's not one in your area. But I found in middle-sized towns, we just used what we had, and it worked really well. So again, if you have any questions, let me know. And I will send you an email tomorrow with a copy of these slides, so you didn't have to, take notes. You can just go through the slides on your own. And this is being recorded, so if I can figure out how to do it, we'll send out the recording as well. Oh, thank you, Jesse. He's thanking me. And yeah, if you want to show this to your teachers, again, this is what worked for me. It may not work for you, but maybe some parts of it would work for you. So here is my contact information. It's just cpeterson@napacoe.org. And I thank you so much for your time. It's 4:29, so I think we nailed it on time. And thanks so much for joining me. You're welcome.